Dr. Raegan, and I'm an OB-GYN. And today, I'm going to answer some of the most searched questions about what can and can't get you pregnant. Let's see what people are looking for. We'll start with, can I get pregnant if it was just the tip? Yes. Pregnancy is possible anytime sperm has a chance to meet up with an egg. That can happen whether sperm gets into the vagina or onto the vulva. Typically, pregnancy happens when someone with a penis ejaculates into the vagina or onto the vulva of another person. Ejaculation is when semen, whitish fluid containing sperm, comes out of the penis. But it is actually also possible to get pregnant from pre-cum too, the fluid that can come out of the penis before ejaculation happens. That's because pre-cum can sometimes contain sperm. If you've had a penis in your vagina or touching your vulva, no matter how much of the penis went inside, and you're not using birth control of any kind, including condoms, you may want to consider using emergency contraception. Another question we get asked a lot is, can I get pregnant if I miss one pill? Yes, you could. How likely it is that you'll get pregnant and what to do once you realize you've missed a pill depends on what type of pill you're on, how long it's been since you took your last pill, and how far into the pill pack that you are. If you're on the combination pill, which is the most commonly used kind of birth control pill, and it's been less than 48 hours since you last took your pill, take the pill that you missed as soon as you remember. It's okay if that means that you're taking 2 pills, the missed pill and today's pill, at the same time. Keep in mind that if you do take 2 pills at once, you might feel nauseous, so try taking them with food. If it's been more than 48 hours since your last pill, meaning that you've missed more than 1 pill, take one of the missed pills as soon as you remember, leaving the other one in the pack. Then, take today's dose at the time that you normally would, and use a backup method of birth control, like condoms, every time that you have sex for the next 7 days. The first week of the pills is the most important in preventing ovulation. That means that if you miss a pill in the first week of your pill pack, it's a bigger deal than missing a pill in a later week. In addition to taking your missed pill ASAP, you will also need to use a backup method of birth control every time you have sex for the next 7 days. If you're on any brand of the mini pill, also called the progestin-only pill, besides Slind, including if you're on the over-the-counter mini pill O-pill, there are totally different rules. If you're less than 3 hours late taking your pill, just take it as soon as you remember, and continue with your regular schedule for taking your pill. If you're more than 3 hours late taking a pill during any week of your pill pack, you could get pregnant if you have sex without using another form of birth control. You'll need to take your missed dose as soon as you remember, and then take the next pill in the pack at the same time that you normally would. It's okay if that means you'll be taking 2 pills in one day. You'll also need to use a backup method of birth control every time you have sex in the 48 hours after taking your missed or late dose. If you have already had sex without another method of birth control, and then realize that you missed a dose of the mini pill, you may want to use emergency contraception as soon as possible. A lot of people ask, can I get pregnant from semen on an object, clothing, or other body parts? Anytime semen gets inside the vagina, the inside part, or on your vulva, the outside part, you could potentially get pregnant. So if your partner ejaculates and semen is on their hands, and then they immediately touch your vulva, you could get pregnant. And if they ejaculate onto your vulva while you're wearing underwear, the wet semen could soak through your underwear and lead to a pregnancy. However, if the semen is dry when it touches your vulva or vagina, it is unlikely to cause pregnancy. Sperm exposed to air loses the ability to swim and can only live for a few hours or less. This applies to wearing or touching clothes with dried semen on them, or touching other things with dried semen on them, including sex toys and fingers. Dry humping, oral sex, and anal sex also cannot lead to pregnancy, unless somehow cum or pre-cum gets onto the vulva or in your vagina before it dries. We also hear this one quite a bit. Can I get pregnant after an abortion? Having an abortion doesn't change your chances of getting pregnant in the future. In fact, you can get pregnant again pretty quickly after an abortion. So if another pregnancy isn't in your plan soon after your abortion, it's a good idea to talk with your provider about starting birth control after your abortion. Can I get pregnant if I have PCOS or endometriosis? The short answer is yes. It is possible to get pregnant while having PCOS or endometriosis, but it may be less likely for you to get pregnant than it is for people without those conditions. People with polycystic ovarian syndrome, or PCOS, experience an imbalance in their reproductive hormones that causes irregular cycles and can prevent ovulation when an egg is released from the ovary, or make it less predictable. If an egg is not released, then it can't be fertilized by a sperm, and a pregnancy can't happen. People with endometriosis have tissue similar to the uterine lining that grows outside of the uterus. This can cause inflammation and scarring that can make it more difficult for some people to get pregnant. Both conditions can make it more difficult to get pregnant, but it is still possible. So if you aren't looking to get pregnant right now, or ever, it's important to use birth control, whether you have one of these conditions or not. These are great questions. Keep them coming. For more information from experts about all the things you're wondering about, visit bedsider.org.